My name is Jenny, and I'm a Master of Social Work student, currently completing my practicum at the Edmonton Federation of Community Leagues. In this series of pop-up workshops, I want to explore a few terms and theories that are currently receiving a lot of attention from researchers, policymakers, and community organizations across Canada. The first one is social isolation. In upcoming sessions, I hope to cover inclusion, social capital, and neighborhood resilience. These terms or theories are all relevant to leagues because they call for neighborhood level intervention. Hopefully, having a greater understanding of the terms will equip you or your leagues with language to engage in meaningful conversations with your communities, your city partners, and your funders. Social isolation is a term that you will hear used widely, both in Canada and internationally. It has been proclaimed by the UK's Prime Minister as one of the greatest public health challenges of our time. It's a key focus of the Tamarack Institute, which is a leading Canadian hub for research around community work. And just this year, the Ontario Minister of Health released a report that explores neighborhood level solutions to social isolation. So what is social isolation? A person experiencing social isolation will have few social contacts, little meaningful interaction, or lack of mutually rewarding relationships. Social isolation is often interchanged with loneliness, but they are actually different. While isolation can be described through objective, that is like observable behaviors, such as actions and contact with others, loneliness is subjective. It's something that we feel. Many of us may feel lonely, but are not necessarily socially isolated. It's that classic, you can feel alone in a crowd full of people. And someone could be socially isolated, but not necessarily feel lonely. So while they are not synonymous, there is a really strong relationship between being socially isolated and being lonely, not surprisingly. So why is social isolation such a big deal right now? What are the negative impacts of it? So people who are isolated have a 50% greater risk of dying early than those with strong social connections. It has about the same negative impact on health as smoking 15 cigarettes a day. Social isolation can be twice as deadly as obesity and as big a killer as diabetes. It also increases the risk of dementia, by 64 times. Poverty and social isolation are risk factors that can also contribute to crime, family instability, childhood abuse, and neglect, especially when there's an intersectionality between social isolation and poverty. We see negative outcomes kind of growing exponentially. So who's at risk of social isolation? Who is impacted? Well, research illustrates that newcomers, seniors, members of the LGBTQ+ community, people with disabilities, and people with low income are more vulnerable to social isolation. There's also a relationship between social isolation and living alone, which is also not surprising. The total proportion of the population that lives alone in one-person households has actually quadrupled over the last 3 generations. Rates of social isolation go up exponentially in relation to poverty and social exclusion, which I had sort of said previously. However, social isolation also affects people from all socioeconomic levels. I'm sure if you think of your own story, you may be able to identify a time in your life when you felt socially isolated, whether it was moving to a new place, experiencing unemployment or illness, or for myself, it was when I was a stay-at-home parent or a new mom. So all of us can be in this position of feeling socially isolated. Being socially connected to family, friends, and our communities, having a sense of belonging, it is important to our well-being. People who are connected are happier. They enjoy better health and use fewer health services. They are more resilient in the face of adversity, and they actually live longer. Community engagement, in particular at the neighborhood level, has become increasingly important in preventative strategies. And we see this at the municipal, provincial, and federal level, that we are recognizing the need to connect with neighborhood level interventions. How can we address social isolation if the individuals most vulnerable are the least likely to access services? So here we have enter the power of a strong neighborhood. Leagues make connections between people, between neighbors that is, and this is a powerful tool in preventing social isolation. Neighborhood associations and city programs like Abundant Communities are also incredibly impactful when it comes to making those connections. So there's actually a study in rural Alberta that found people who were connected to their community associations experienced lower rates of social isolation and thus lower rates of depression during downturns in the economy. So that's a little introduction to social isolation and some of its impacts that we see. In the next pop-up session, I would like to explore the term social inclusion with you. Thank you so much for listening.